Well, thank you guys for joining us today. I am Dr. Lum. I'm a pediatrician and founder of Generational Wellbeing. I am really passionate about helping mothers create healthy habits for themselves and for their families for generations to come. Because as we know, those healthy habits are really key in preventing chronic disease and really helping you live your best life. And I am so honored to be joined by Dr. Mitra, who's going to go ahead and introduce herself to us.
Hello, thanks for inviting me on. I'm Dr. Mitra Ayazifar. I'm an ophthalmologist in Northern California, and I am also the CEO of Capital Eye Medical Group, where we partner with patients to develop their best vision and enjoy their life and their hobbies for years to come.
Awesome. Thank you for joining me today, Dr. Mitra.
Of course.
So let's get started. So I know, eye care and vision is just one of those things that I find in practice with pediatrics and talking to so many parents, a lot of people really do not pay attention to. But it is really the opening to, your vision is your opening to the world, right? I can't
Absolutely.
imagine life without a vision. So and so you can say that in so many words. But we'll get started with this because I know as a pediatrician in the past, we've really recommended limited screen time for a lot of kids and stuff because of the eye strain it causes. But unfortunately for us, since the pandemic and with the changes, we're seeing, virtual schooling, virtual meetings, virtual
Yeah.
everything, which the recommendations are no longer realistic, right? I mean, when you have to go to school for hours on at a time, a lot of kids and adults are spending extended periods of time, whether it's on the computers, laptops, all other devices. So we'll start by asking, like, what's the big deal about prolonged screen time when it comes to your eye health?
So as far as, prolonged screen time, I definitely, my kids are older. And
Yeah.
so so we're past that time, and I think, as you said, it's very difficult these days to because the kids are doing their homework on online and, on iPad or whatnot. The main thing that we need to try and do is decrease their time, not for the homework, but the actual time that they spend, playing on their iPad for games or things like that, because they really we need to encourage them to go outdoors, have activities outdoors rather than having more time on their screen. So spending, I think below the age of 2, it's not even recommended for them to have any screen time as far as Academy of Pediatrics is concerned. And between the ages of 2 to 5, I think it's supposed to be limited to like 1 hour of screen time, which if they're doing anything that's related, I don't know that schoolwork is related, but 1 hour, and that's 1 hour of unsupervised. So definitely that's like the maximum. We definitely want to be there to, kind of monitor what they're doing and whether or not the babysitter is off somewhere and, the child is, on their own or even in contact with screen time as the parent or the babysitter is using it. So because this is causing kids to have a lot of near work activity, so, in order to see they're holding the iPad or, spending time on the phone or whatever they're working on, this can cause the eyes, the eye strain can be more because our eyes kind of turn in order for us to be able to accommodate or look at something close up. So sometimes kids will have complain of headaches, or even they'll have accommodative spasm where they'll feel pain almost in the frontal area, but also because they're not blinking, that will cause dry eyes. And so they will, over time, even as adults, we've noticed that there's a loss of Meibomian glands or tear glands in the eyelid. So the interesting thing, to give it a sense of how much less blinking, we do, it goes from 30 times per minute as we're, communicating with somebody, let's say next to us or in front of us, to 4 times, because we're
Wow.
focusing on something close up and we're not blinking.
Wow. Wow, that's impressive. I didn't even think
That's
about it. Like that's like a huge difference right there. And without the blinking, I have seen quite a few kids too with dry eyes. I worked yesterday. It's like almost every other kid has this just bloodshot red eyes where it's just yes, we have allergies and pollens out there. We have pink eye, but it's just like red eyes that you know is not either allergy related or infection and stuff, but just from really that screen time with red eye from that strain.
absolutely. And the because I was doing a little bit of reading, obviously, because I didn't want to just infer my beliefs. So I wanted to make sure that I check with Academy of Pediatrics and also Academy of Ophthalmology. But based on studies, there has been an increase in the number of people that are nearsighted, or even kids. The number of nearsighted, people that have to be able to, can only focus more close up rather than far, has increased since the 1970s, I believe. And I don't have a percentage, but it's a rapid increase. And so that has a lot to do with the work that we tend to do close up. So I know that we need to pick our battles as adults, as parents. And so for kids, I found one recommendation by a pediatric ophthalmologist. Her name is Dr. Rupa Wong, and she practices in Hawaii. So I'll give a shout out to her. She has a method. I don't know for what age this may work, but there's like a checklist, where if kids have made their bed, done chores, specific chores, help somebody in the family, they have gone outside and played for at least 15 minutes or done reading something like that. You can set that up for your family on your own. Once that checklist is done, then maybe they can have a little bit of screen time, because obviously both parents working, it's really difficult to kind of put this in motion or control it when you're not the one that's home with the kids. So hard to do, but just some suggestions. Pick your battles though.
Right. Definitely picking your battles. And also, some things we usually suggest so is just, encouraging frequent breaks in between. Like you said, the blinking is reduced. So just, being intentional about telling them, sometimes we say 20, where like,
Exactly.
20 minutes of screen time. And then like in 20 minutes, okay, pick some, look outside, do something else where you're kind of moving your eyeballs, forcing yourself to focus on something else and blink maybe, right? And then
Absolutely.
back to the activity where you're not just sitting there and straining and causing the strain and stuff too.
Absolutely. And that
Hmm.
20-20-20 rule applies to adults also. And, making sure that we're not constantly focusing in. Of course, for adults, it may be a little bit difficult to set the iPad or whatnot at least like 25 inches away. But for kids, kind of, mentioning that. And also, if they're reading books on, let's say, Kindle, that's still a digital device. So maybe alternating that with actual books would be good. And, just kind of having somebody suggested a family media plan, and, making sure that you're setting an example for your kids, that you're, interacting with them, and making sure that you're, present as you're spending time with them, not every single member of the family on their digital devices. Again, this is not about shaming. This is just about suggestions. I have, remember there were times that I gave up the fight, in certain days, but I definitely understand. But the thing to remember that it's not just about kids being on the screen and having eye strain, right? There's a link with increase in obesity in kids because they're not going outdoors, they're not being active, they're especially if they're gaming, they're sitting down and they're on their devices or playing games, and so they're not spending time outdoors, they're not interacting with others. And of course that can also lead to, there's a link with attention issues in the classroom also. So all of these things, it's not just about the eyes, because I vision is not in isolation, or eye health is not in isolation. It's, related to so many different things: our nutrition, our, you know, genes, what we inherit, family background, all of that has a lot to do with it.
Absolutely. And speaking about health and stuff, we know that, speaking of like the activity level and stuff, we know diabetes, high blood pressure, all of those things affect your blood vessels, which, including the blood vessels in the eyes that we don't really, pay attention to. But then if you have any of those diagnoses, you definitely have to see your eye doctor, right? To make sure you're constantly looking at those vessels in the back of the eye and stuff, right?
Absolutely, absolutely. So with, as far as, I don't know if you wanted me to kind of mention, because it's really hard to know in kids, and then up to adults, really what to look for if they're nonverbal and they can't come up to parents and say, I can't see that. Of course they can't, right?
Right.
So, or if both eyes are, let's say they have astigmatism, or they're nearsighted or farsighted, like maybe mom or dad have been, they don't know any different. And I'll tell you, my son has taken after his dad, and so his dad has worn glasses for a long time. And so I remember when he was a kid, probably at 3 years old, he was sitting really close to the TV and just watching it, very closely. Like he was maybe 2 feet away, but very close. And we thought, oh, he's, he really likes this show. So don't assume that it's because your child likes this show. And when we went to one of his screening visits, to the pediatrician, they tested his eyes, vision screening, they tested his eyes, and they said, well, it's actually one eye is different from the other one. So that's another sign when you go to the pediatrician's office and both eyes are not quite the same, or, it's not to the level where you expect at that age of development, which, pediatricians and family medicine specialists will know much more than I do. But anything that kind of, puts up a red flag where this might not be it, you might want to send them to a pediatric ophthalmologist for a comprehensive exam, or in your area, if there's no pediatric ophthalmologist or nowhere near, you can send them to an optometrist that specializes has a peds practice, because it takes
Right.
a certain amount of patients to do that exam. And so if your kids if you don't have any verbal cues, right? So things to look for, or if your child doesn't say anything, so they sit too close to the TV.
Right.
Or as they're looking, they're squinting at the TV screen or whatever screen, their Zoom program or whatnot. And so they're squinting, because when they squint, it almost does what's called a pinhole effect, where you're able to get rid of the peripheral rays and kind of just focus in on the area that you're able to see better, almost like taking away the effect of astigmatism. So if they're doing that, or you're noticing that they're tilting their head as they're, looking at you or watching TV, either to the side or kind of tilting towards the eye, perhaps tilting their head to the side, where they're using the eye that sees better. And sometimes even, covering one eye, or you'll see them. And these are things that you can watch out for. They'll cover one eye or even just close one eye entirely, because they're trying to use the eye that sees better, or the one that's aligned properly.
Right.
And of course, eye pain, when they, complain of eye pain, maybe they have refractive or vision problem where they need to really bring the muscles in. And so they begin to get a spasm in the eye that gives them that discomfort.
Awesome, amazing things to look out for, because we will see kids doing those behaviors and we just think, okay, it's just them, they love the program, like you're saying, or they're just acting out. So those are great tips or things to look out for if your kid is having or looking at the TV or any other thing. That way it's just, clues to say maybe it's time to see a pediatrician or to go see your eye doctor, right? Okay. Now, what about tips? Can you give us any tips for healthy eye care, preventive? What can we do? Like, right, we're going out every day, we're using this eyes and stuff. Like we said, there are chronic disease. We can do healthy habits for chronic disease. What about specifically for your eye health?
So for your eyes, absolutely make sure that you're protecting your eyes against the UV rays, right? We haven't even talked about blue light, but against UV rays. So whenever you go outside, especially if you're living in, high elevation, when there's a lot more exposure to that, even if it's cloudy outside, honestly, you do need to have some sort of protection against UV light, because that can cause you to, obviously UV damage can cause you to develop skin cancer, of course on the face, but especially in my practice, which is eyelid and adult cataract practice, I see a lot of lumps and bumps around the eyelid that end up being skin cancer, because it's UV rays, UV damage built up around the lifetime. And then, of course, UV light can also damage, can also cause progression of cataracts. So let's say if I were to develop cataracts at the age of, let's say 60, that's pretty early still, but maybe with UV damage, it would bother me, become visually significant at a lot earlier stage. So you can protect your eyes against that. Also, it can damage the retina. So wearing sunglasses, a good pair of sunglasses, will help the sun damage or prevent the sun damage to the retinal layers, especially macula. That's one of the risk factors for macular degeneration. And macula is the center part of the retina, which is responsible for your fine detailed color vision. And so we definitely want to do everything we can to protect that. And any health conditions that we have, like you mentioned, diabetes, hypertension, keeping that under control, especially with diabetes, time under control is very important. Percentage of time under control. Of course, we do the, hemoglobin A1C. We want to know over the past 2 months how the blood sugar has been. But really making sure that over time, we're being very vigilant about controlling that, going to the eye doctor, managing our blood sugar. Hypertension too, because they can cause delicate areas in the blood vessels. They can damage the inside of the blood vessels. And so the blood vessels in the retina especially can become leaky or bleed, and it can lead to loss of vision when uncontrolled. And that's just in the eye. So that can be affecting you all over the body.
Right, right, absolutely. And you said UV light, right? What about, back to the screen time and the screen light and stuff? Or with is there any particular setting you would recommend just to help with your eye or vision?
Yes. So, obviously screen time in kids is different, but making sure that at least two, so basically the blue light, I know there's a lot of conversation with the blue light and getting these blue light glasses for specifically for computers, because our kids are on the computer all the time. So blue light affects your circadian rhythm, right? So if you are constantly on your phone, and this includes adults, and some of my sleep specialist colleagues will appreciate this. If you're on your phone, that is going to confuse your body as far as, oh, it's nighttime, I need to go to sleep, because you don't appreciate that. So it affects your melatonin production. You become a little bit confused. That's why when the sun is out, that kind of signals our body that, hey, it's time to wake up, and, kind of let you know that everything needs to open up and be awake. But if you're using that screen close to bedtime, and especially if you have to be on it, maybe putting it on the nighttime setting, or kind of a decreased background light, that might be helpful. And making sure as much as you can with these days, doing remote work and at home work, limiting the time that you're spending on that. But it can definitely confuse your body as far as sleep is concerned.
Right, and sleep is a big deal these days, right? Both kids and adults, where like I can't shut it down, I can go to sleep, or lots of nighttime awakenings again because our melatonin, our circadian rhythm is really interrupted, right?
Absolutely. Absolutely. Yes.
All right. What about oh, were you going to say something else before I move
No,
on to?
I think I covered the things that I was going to mention. Absolutely.
What about eye makeup? I see a lot of teenagers, especially, oh, amazing big lashes, right? And and mascara and stuff. How does that affect your eye health?
Okay, that's a very good question. So we'll keep it simple. Not even, I mean, of course, the fake eyelashes or artificial eyelashes, the ones that are glued on. Um, you want to make sure what that does is it can cause inflammation around the eyelid. And the eyelid, you have several types of glands, but especially the ones that are really affected by this are the Meibomian glands, or the glands that produce the oily layer onto your tear film every time you blink, so that the tear film stays stable and it doesn't break up. If you don't have good quality tear film, then you're constantly kind of blinking your eyes, feeling like, oh my God, it feels so much better if I just close my eyes. Especially, dry eyes, comes under, it has a whole umbrella. But the glue, you can develop an allergy to it. So after a while, when they put on it, even if it's the sensitive, glue for sensitive eyes, it can still cause the inflammation, cause blepharitis, which is inflammation of the eyelid, which can later on, cause you to have styes, or, these blocked tear glands that can become inflamed. Your body reacts to it, can become inflamed, and that's when you have to come and see somebody like me to maybe do a little procedure in the office. So try and avoid that, but that can cause dry eyes for sure, drop out of the meibomian glands. Makeup needs to be removed at the end, right before you go to bed. So making sure, whether it's waterproof, not waterproof mascara, eyeliner, that you remove all of that with a eye makeup remover that's safe for the eyelids, because the pigment in the makeup can actually tattoo the opening of these meibomian glands. So when I look at people's eyes under under my slit lamp, I can see dots of the pigment, or even the pigment from the mascara is just kind of floating in the tear film. That cannot be comfortable. That cannot be comfortable. And I have to say, I'm lazy, so I probably put on makeup for you. But I, as long as you can commit to taking it off,
Right.
that's yes.
Absolutely. Really knowing yourself, knowing that, taking it off. If you're having time to put it off, you have to actually be intentional about making the time to take it off as well.
Absolutely.
Okay. One last question. What's your recommendations for dry eye?
Recommendation for dry eye. So dry eye will probably be several, I'll just keep it short. So dry eye, your tear film is made up of several layers. So you have to make sure, okay, what is going on with my eyes? Is it because I have allergies? And so, this season, especially the inside of my lid, all of these tear glands are affected. They're not functioning well. Do I need to treat my allergies with special eye drops? So dry eye is such a huge umbrella. I would recommend that you see your eye doctor to figure out, what is it? Do you
Right.
instigate, are you spending too much time on the screen? Instigate the 20-20-20 rule, like you said.
Right.
Give your eyes a break as you're having to do your work. Just keep them closed for 5 seconds and get back to work. If you can't, you get involved in your work and you have to use a timer, maybe, especially for the kids, to remind yourself to take a break and look far into the distance so you're not looking close up. But certainly, if you use eye drops, the artificial tears that are out there, they will help for probably a few seconds. They're there to help with the symptom. They're not there to help with the underlying cause. So allergies, you have to treat that. Um, you know, um, Anything that's kind of aggravating your eyes. Maybe you have some systemic issues where, like lupus, sometimes they can get keratoconjunctivitis. So maybe you need to be treated for that. Make sure that that's not the case. Or even some medicines can, dry up the tear film. Some antihistamines sometimes systemically they can dry up the tear film. And I think those are, and also your diet. So what can you do about that? So your diet, making sure that you have a lot of omega-3, omega-6, maybe fish oil supplement, maybe having, salmon or whatever you like once a week or twice a week, making sure that you're getting that as a nutrition so that you don't have to take a supplement if you have a, rainbow of foods, I suppose. And of course, flaxseed, just kind of sprinkling that on your food, on your oatmeal, and having that's going to help with the tear glands. And if you're doing all of that and you're like, Dr. Mitra, I'm still having some issues, make sure that at nighttime you have a regimen added to removing your makeup and doing all of that. Make sure that you do some warm, moist compresses on your eyelids. And that's mainly for, blepharitis, basically. So you can take one of these iPads that you can, not the iPad with the digital screen, but you can put it in the microwave for about 10-15 seconds. The specific one that you can get off of Amazon is called Bruder Mask, Bruder mask. And it's easier, so you can put that in the microwave, maybe for about 10-15 seconds, no more, and take that out, feel it, make sure it's not too hot. And then what you can do is, I usually take like a couple of paper towels, fold them, moisten them with a little bit of water. I put that on my eyes and then wrap the Bruder mask around it. And then you just lay back. If you just do this at nighttime, it takes about 2 to 3 minutes for that heat to go away. And so when you take that off, then immediately afterwards, right now, your eyes feel great. You've had 3 minutes of relaxation, but you want to get that thickened material in these oily glands to come out. So you're going to put your finger on the bone here, right after the mask, and you're going to press and kind of hold the pressure and roll up. You're going to do this 15 to 20 times, just the rolling. And what that does is it gets rid of, or at least pushes out, the really thickened meibum that's inside those oily glands. And I would say over probably 8 days or so, 8 to 10 days, you're going to notice that you're feeling better. It's not going to be you wake up one day and you're like, aha, but it's more like, wait a second, I didn't feel like I had to just close my eyes and just not work anymore. It's like a lack of those symptoms that were bothering you before that you'll notice, or you're not using artificial tears in your eyes as much.
Amazing. Thank you. That was a great tip because I see a lot of people just artificial eye drop after the next, like for months on end, and we're not really paying attention to the underlying and really listening to the feedback that our body is giving us to fix the underlying issue. Thank you very much. And I really particularly like that last tip because you can tie it into your bedtime routine where as a part of your relaxation, you're shutting everything down. You're calming not only your eye, but you're calming down your brain, shutting it down for preparation for you to go to sleep and have a good night's sleep, which is important for your overall health as well.
Absolutely.
Right.
Absolutely.
And you're right. And also with the foods and stuff, we're so quick to reach out to supplements whereas, once you start looking at those healthy food options, rather than like one vitamin C here, vitamin E here, vitamin D here, you end up taking like 10 pills whereas if you had to pick up even a leafy green vegetable, will have all of those vitamins on there and cost way less than buying the vitamins in particular. I know with the eye health, the omegas are really good, with the oily layer like you explained to us. Avocados, seeds are amazing for that. The vitamin C's, we can buy all the vitamin C pills, or you can grab an orange, kiwi, papaya, and all those things that do not have only the vitamin C but also with the vitamin E and the vitamin A, all of those which are really good for your eye health, right?
Absolutely. The surprise to me was, and I'm sure you've known this forever, but I didn't realize that kiwis have a heck of a lot more vitamin C than oranges do. I did not know that.
Yes.
And I was
Yes.
amazed. I was amazed at that. But yes, all of those, one thing that I keep hearing, and this is why lifestyle medicine and just treating the whole patient and whole family is so important, is because we've forgotten to prevent diseases. We're kind of in a society or a time where we're trying to, solve not the underlying problem and prevent diseases from happening, like diabetes, hypertension, obesity, all of those, but to, prevent it from happening rather than treating it with medications after the fact. It's very, very important to do preventive mechanisms in place.
Yes. Well, thank you. Thank you very much, Dr. Mitra.
Okay.
Is there anything else you would like to add before we?
Oh, no, but I'm in Northern California. I certainly have colleagues that treat pediatric patients. And if you are wondering whether your child needs to see a pediatric specialist and a pediatric ophthalmologist, please ask your pediatrician, your family practitioner to refer you if you have any doubts. You're not supposed to diagnose your patient or your family member.
Amazing. Thank you. And if you're in the Northern California area, check out Dr. Mitra. She has two amazing locations there, and she's doing amazing work with her patients.
Thank you.
Alrighty. Well, thank you again for joining me today. I hope this has been valuable to those who've listened in. If you have any questions, comments, you can leave it in or send me a DM, and I will be sure to get back to you. Thank you guys for your time, and have a wonderful day. Thank you, Dr.
Thank
Mitra.
you. Thank
Bye.
you. Bye.